For a male patient, continue by inspecting the breasts, which should be smooth with no nodules or swelling. Remember that gynecomastia, or breast enlargement, is normal in males only during puberty. Next, palpate the nipples and breast tissue, checking for nodules. You should not find a nodule. Also, check the axillae, which should have no enlarged lymph nodes. For a female patient, perform a more detailed breast assessment. First, inspect the breasts. In most women, one breast is slightly larger than the other. The breasts should be smooth, with no redness, lesions, dimpling, extreme vascularity, or retractions. Lymph nodes in the breast area should not be visible or bulging. Next, assess the nipples, which should be symmetrical and show no scaling, discharge, lesions, or bleeding.
Raise your arms up above your head.
Now watch the patient as she raises her arms,
Good. Now put your hands
presses
on
her
your hips.
hands on her
Press
hips,
your hands on your hips. Press for me.
and leans
Now
forward.
lean forward.
In each position, you should see no puckering, dimpling, or retraction. As the patient leans forward, her breasts should swing freely. Using the pads of your middle fingers, palpate the axillae to assess the lymph nodes. This illustration shows the lymph node chains in the breast, axilla, and upper arm. Be sure to reach behind the pectoral muscle and move your fingers toward the clavicle and down against the ribs. Small, freely movable lymph nodes are normal.
Lay down for me.
Instruct the patient to lie down and place a pillow under her shoulder on the side you'll be examining.
You put this arm
Then
up.
ask her to raise her arm on that side.
What I'm going to be
With the pads of your middle fingers, use a circular motion to palpate each section of the breast, starting at the nipple and moving out in concentric circles. As you do this, teach the patient the proper palpation technique and encourage her to do a breast exam monthly.
Now I'd like you to examine your breasts each month the way I'm doing it now.
If you prefer, you can use an in and out pattern when you palpate. Or you can sweep your finger pads across the breast. No matter which pattern you use, be consistent and remember to palpate the tail of Spence. Next, palpate the nipple, compressing it gently. You should not detect any induration or masses. If you see nipple discharge, obtain a culture. If you suspect a mass, try to elicit dimpling by moving or compressing the tissue, and check the opposite side for symmetry. If you find a mass, document its size, shape, consistency, mobility, and degree of tenderness. When documenting your findings, mentally divide the breast into 4 quadrants, or imagine the breast as a clock face. Now check the epitrochlear lymph nodes by palpating the groove between the biceps and triceps muscles. The nodes should not feel enlarged or tender.